Our next speaker this evening is Cindy Jimmerson. She is the founder of Lean Healthcare West and a pioneer of Lean for Healthcare, having initiated her Lean work with a grant from the NSF from 2001 to 2004. So based on her 30 years as a trauma system developer and emergency health care provider, she's going to give us an insight of how we can get from waste to opportunity. Please welcome Cindy Jimmerson.
Thanks so much, and before we start, I have to explain that this is the first time I've ever worn my red ants pants to town, but I wore them for you. So. I'm very happy to be here tonight because in my 44-year career in healthcare has been spent almost exclusively in rural communities, and this is where I live and love. Right now, it's no surprise to anybody, we're embroiled in healthcare reform. And I think one thing that we've learned is that a piece of legislation is not likely going to save our bacon. If you consider the 9 lovable presidents who've worked with that effort in trying to fix healthcare with legislation, I think that we have to come to the conclusion that we have to do something else. That's probably not just all we can do. That realization led me several years ago to consider improving healthcare by fixing some of the broken processes that don't support us in doing our good work. Interesting concept, right? Which led me to the Toyota production system, not a very likely match for healthcare, except that they believe that the people who do the work and their whole philosophy and their success is based on mining the good ideas from the people who do the work. And I think that we have some real advantages here. Now, before we get on to talking about what some of those approaches can be and what the fixes are, consider the demographics. It's my generation that's really going to mess us up here. There are 77 million baby boomers who started retiring a bit ago, and we have increased the demand on health care. Also, we are retiring out of the workforce, and there aren't enough millennials and digital natives and whatever else to replace us in the workplace. And what that means on a practical level is if I can't hike in the Bitterroots anymore without pain in my hip and my doc tells me I need a hip replacement, I'm going to have to wait. Maybe for years. And what happens to old people who don't move around? They don't do well. And their increasing disability is going to add even more burden to a system that's already taxed. So we really have to look at what the baby boomers are doing for us here. There's one other consideration of that three-legged stool of baby boomer retirement, and that is we're going to stop paying big taxes. We're going to stop living with our employer-supported health plans and start relying on Medicare to pay our bills. So the picture is the demand is going to go up, there are going to be more people to care for, fewer people to do it, and less money to do it with. That is an insanely dismal picture unless you consider the next experience. In 1999, Dr. John Canady and I observed on a busy med-surg unit in a really big hospital in the East, and this is what we saw people doing. 64% of their time was spent looking for things they couldn't find, clarifying things that were unclear, and doing redundant paperwork. And if you apply that 64% to what our predicted cost of healthcare is for this year, that means we'll spend $2 trillion looking for things we can't find, doing redundant paperwork, and clarifying things that are unclear. But imagine if we could cut that in half. We'd have enough money to take care of every citizen in the United States and reduce the frustration in healthcare. So I said that rural people have an advantage over city folks, and I think that John already touched on that. We have smaller and less complicated systems, and we have really good access to our leadership, and they're more involved in problem solving than you could ever get in a large community. So it is only through mining the good ideas of the people who do the work that the complexity and frustration in our systems can be reduced. Our goal then is to try to go out and recognize those obstacles that we have to work around in our daily work and try to work with more continuous flow. It feels better, it looks better, it costs less. But it doesn't happen overnight, and it's not automatic. We have to think differently. There's no way that we can fix tomorrow's problems with old school thinking. So this weekend, I challenge you to get out there and think about your daily work and come up with some solutions, like the smart Japanese farmer who put little cardboard forms around his baby watermelons and created a fruit that's easier to stack and easier to transport and easier to display in their stores. I really, really believe we have enough money in our system to take care of everybody, but we've got to get rid of those roadblocks that consume our talent, our compassion, and our joy of work. Thank you very much.